Dr. Jere here. This month we are going to be focusing on the low back. As we start to move in the spring, everybody wants to get out and enjoy the nice weather and start doing, yard work and things like that. And so this time of the year is a lot of times where we see a lot of low back issues. In fact, low back issues are the most common reason that people around the world will see a doctor. It's also the most common reason that people will miss work. If you've dealt with back pain in the past, or maybe you're experiencing it right now, you know that back pain can really challenge your life and can interfere with everything that you want to be able to do, and it can happen in an instant. Not being able to enjoy hobbies and difficulty with your ability to work, and just kind of this subtle underlying feeling like, is this thing ever going to go away? Am I ever going to get back to normal? These are all the things that people experience when they experience low back issues. Now today I want to dive a little bit into what are some of the common causes of low back problems, and then as we move throughout the month, we're going to dive a little bit more into some details about treatments and activities and different things that we can do to try to prevent the back pain. But a lot of times what causes a back problem is really just repetitive stress or previous nagging injuries that have not healed correctly. And then you throw in an inflammatory diet on top of that, and lack of exercise and movement. And all those things can kind of build into ultimately causing a low back problem. One of the most common causes of low back is a simple sprained strain. You kind of think of like a wire, you can bend it so many times, just back and forth, right? But eventually, if you keep bending it, it's going to break. And that's a lot of times what happens. A lot of times patients will come in and be like, hey, doc, I wasn't doing anything. And first of all, a lot of times that's the initial sign that that's where the problem is, right? I haven't been doing anything. But oftentimes what it actually is something simple like bending down to tie your shoe or something like that, and then they're like, that low back kicks in. Well, it wasn't necessarily the bending down to tie the shoe that was the problem, right? It's the fact that vertebrae's been in there wobbling around and stretching until finally the tissue had enough, just like a piece of wire that you've been bending back and forth. Eventually it breaks. And so a lot of times that's really one of the more common reasons for back issues. And it also often sets the stage for the next couple of reasons that people experience back problems, which is disc issues. So as we wear and tear down the supporting structures, we also start to wear and tear down the disc. And so disc bulges and herniations can be a common cause of low back issues and cause of sciatica, which we'll talk a little bit more in a couple of weeks about. And then the last one is arthritis. Now, the interesting thing with arthritis is that arthritis really does not cause pain. It's one of those weird misnomers that we have. A lot of times we'll shoot an x-ray and we'll see degenerative change occurring, and we're like, oh, that's what's causing their pain. Well, the truth is that arthritis in and of itself is not painful. It's when we look at arthritis, what we see is previous injuries that have accumulated over time, and arthritis becomes painful when it's inflamed. That's why eating inflammatory foods and things like that can be a cause of low back pain, because it increases the inflammation or the amount of pain signals coming from that area. But there's lots of spines that I look at all the time that have really bad arthritis, but they don't have pain. And then there's other spines that I look at that have really mild arthritis, but they have a ton of pain. And really it gets back to, like I said, kind of that current inflammatory status of the person, as well as, if they're rubbing on the wrong areas and misaligned and all of those things. And that's, one of the reasons that I have a job is to try to figure all that out. But the thing is low back issues is extremely common. About 80% of people in the US will experience back pain at some point. And while it may feel like you'll never get back to your old self, chances are you will. An overwhelming majority of people can recover from back pain naturally, or maybe with a little additional support from a chiropractor. But even if you do recover, what I need a lot of people to understand, and one of the things, issues that I see is just because the pain levels go down, that just means that the inflammation or the acuteness of the injury starts to resolve. There's still some underlying mechanism that needs to be addressed to try to prevent the next episode episode of back pain and back problems, because those micro injuries or those little injuries or those self-resolving injuries, right? Those are all warning signs that something's not working right. And each time we experience one of those, we're creating a little bit more damage and a little bit more damage, and actually making it more likely that we're going to experience the next bout of low back pain. So if you experience low back pain, or you've experienced it in the past, and it keeps reoccurring, get in and see your chiropractor. Let us try to figure out what we need to do, what we can do, and develop some strategies to avoid some of the long-term consequences of back issues. So anyway, I hope you enjoyed this brief little lesson on back pain. Tune in next week as we unload some more information for you. So stay healthy, stay well.